Hey everybody, what's up and welcome back to the Relationship School podcast. Or welcome if you're new. What's happening? Great to have you here. Thanks for all the awesome reviews, guys. This podcast is all about love, partnership, connection, relationship, and doing that part of your life really well. Okay, you're all really busy. You got full lives. Maybe you're overwhelmed, etc. And my assertion here is that if you double down on relationships, the rest of your life is going to take on a whole new meaning, and you'll have a home base, which is called a partnership or a very close friendship, to then tackle all the challenges that you got going on. So if you want to improve your life, I think really developing your relational chops is essential. Okay, it's unbelievable what it's done for my life. So consider that. All right. And just wanted to, again, say thanks, guys, for the great reviews. Here's one from Tom Booley. I've listened for several years and keep loving your content. I just listened to your interview with Annie Brooke and was so moved. I live in Boulder and actually went to see her. It was life-changing. Thanks, Jason, for all you do. Nice. I hope I've turned you on to some extremely talented clinicians, therapists, coaches, authors, couples, and you've actually read and you've taken action and something's changed in your world. If so, please leave us a review as just a way to say thanks. You can do that on Apple Podcasts just with your thumb. It's very straightforward, okay? We're also on Spotify now. So if you like Spotify, throw us down on your playlists and listen to us there. Okay, in this episode, I have another fellow Boulderite, Arielle Schwartz, Dr. Arielle Schwartz. And she is a licensed clinical psychologist, author, EMDR therapy consultant, and teacher, certified Kripalu yoga teacher, and she has her private practice in Boulder. She got her master's degree where I did at Naropa University. We talk about that briefly in this episode. Her newest book is called The Post-Traumatic Growth Guidebook, Practical Mind-Body Tools to Heal Trauma, Foster Resilience, and Awaken Your Potential. And I recommend you check that out, okay? This woman is extremely educated around trauma, and I just really had to get with her to go, Arielle, what's the deal here? So we mostly talk about trauma and post-traumatic stress disorder, PTSD. We talk a little bit about resiliency, and I think this podcast is going to be extremely useful if you're a therapist or if you've experienced trauma in your life. I think you're going to learn a few things here. She has a really cool frame on titration here that I think you're going to like. Okay, let's get right into it. Here is Dr. Arielle Schwartz. All right, welcome to the show, Arielle Schwartz.
Thank you, Jason. It's great to be here.
Yeah, good to see you again. Thanks to our mutual friend Katie for introducing us many years ago.
Mm-hmm.
Shout
Katie
out to
Lewis.
Katie. Mm-hmm.
Yep. I'll send this to her.
Same woman that introduced me to my wife. So love that woman. Arielle, I'm really psyched to get time with you. Your new book, The Post-Traumatic Growth Guidebook, is out, and we'll talk a little bit about that and PTSD and trauma, but I really wanted to get a sense and have the listeners get a sense of who you are. So just give us kind of the bio up top, like who are you right now in the world, and then we'll get into kind of how you got into that.
All right. I love that. Thank you, Jason. So I'm a clinical psychologist, and I'm a yoga teacher. I'm a mother. I've got 2 kids, 2 teenagers now. I live in Boulder, Colorado, which is right around the corner from you, and ended up here kind of similarly to you. Came out here to go to Naropa years ago. And when I completed Naropa, I went back to school and got a doctorate in clinical psychology, really to study the integration of mind-body therapies into clinical practice. Mm-hmm. And so I focus my practice primarily on the treatment of trauma and working from a strength-based or resilience-based approach to trauma recovery and complex trauma recovery.
Wow. So cool. And okay, so let's rewind the tapes pre-Naropa. Mm-hmm. What was going on in your life that had you want to pursue psychology in general?
It's great. And particularly somatic psychology. That really was the turning point. So I'm one of those people that feels a lot. So whether you call it yeah, like me too. So you call it highly sensitive person or highly empathic, right? So in my family of origin, I grew up with a lot going on in my household. There was a lot of strife happening. By the age of 2.5, my parents were on their way to divorce. By the time I was 4, they were completely separate. And then by the time I was 7, I had 2 step parents and step siblings that had joined our family. So from the perspective of a really sensitive young kid, that whole kind of life, kind of divide and falling apart and having to accommodate to all of these other people and track all of that, because I was very kind of vigilant in my young self, especially because there was a lot of arguing and attacks happening in the first 2 years of my life in my household. So I became a very vigilant child, and I'm sure that contributes to the sensitivities that I that I developed in terms of tracking their body language and their emotions and so forth.
Yeah.
So kind of going forward from there, I started to somaticize, and I didn't have those words for it when I was a kid. Excuse me. But when there would be tension in the home, I would feel it in my body, and I would shut down, or I would have all of these different experiences. I would get sick a lot. And when, then kind of fast forward into high school age, all of those somatic burdens became very much an emotional burden as well. So it started to impact my self-esteem, my sense of self, my capacity to carry myself in the world with confidence. So there was a lot of kind of shame that coupled with all that I felt inside. And fast forward again, when I got into college, I started to unpack this, thankfully. Right? I practiced yoga. I had been introduced to that and found that after practicing yoga that I felt some relief from this experience of myself in the world. I got some distance from it.
Yeah.
Like, well, maybe that's not me. Maybe that's not the whole story of who Arielle is. And then a friend of mine took me to a body-mind centering workshop. And this was the big, bells and whistles moment, the big, you're going to take your life path and you're going over here moment. Because I went to this workshop and we laid on the floor and we crawled around. And I went to Oberlin College in Ohio, and Bonnie Bainbridge Cohen and her folks came up from Northampton, Massachusetts, and they did this weekend workshop with us. And we held each other's heads and rocked each other, and we rocked on the floor, and something just literally broke loose inside of me, where all that I had kind of learned to hold myself together with wasn't possible within this somatic form. And it was certainly overwhelming at the time, but it also was such a clear, the compass arrow pointed north. And I knew that I needed more of that. And it's interesting because it actually ties over into how you and I got to know each other, because initially when I was looking at how do I find more of this body thing, one of the kind of other compass points on that path was toward the natural world. And so when I graduated from undergrad, I didn't want to go right back into university. I didn't want to go back to grad school right away. And so I ended up taking a job for 2.5 years working in Southern Utah at doing wilderness therapy, which is where we met Katie and where we got introduced. And so we're talking, 1994, right?
Yeah.
And once again, just that action of one foot in front of the other on the path, helping other people at this point to find who they really are. And then after 2 years of getting enough sunshine and enough trees, I was ready to go back to school. And at that point, there was only really 3 programs to choose from that had master's degrees in somatic psychology. And I was on such a hunt for what is this body experience? So then in 1996, I went to Naropa. And at that point, the process of what I did in that little mini workshop, I'm going to have you periodically move so I know where we're still going. Good. So I get to Naropa, and the little experience I had at that workshop at Oberlin was now like a daily practice of moving our bodies and being on the floor. The body mind centering experience was very central. We had 2 full years of that with Susan Aposhian at Naropa.
Yeah. Wow.
So
Legend.
Lots and lots of unpacking the somatic burdens, and really for myself recognizing now, I guess even more so, like I can retrospectively go back and understand that I had developed tremendous patterns of dissociation in as how I coped as a young kid with the unique family environment and so forth. And there's other stories that I could loop back in there. But I had really developed a profound level of dissociation from my own body. And so it became a integration process. And Naropa not only was a process of getting a degree, but it was very much a coming home to myself.
Yeah, I'm so with you on that one. For me too.
Yeah.
Wow, what a cool story. There's a couple of highlights I want to jump into, and then we'll kind of get into the interview here. But I'm really appreciating the vulnerability here in the story and your journey. When it sounds like yoga was one of the first things that kind of opened the door for you. Is that right?
That is right.
Because for some people, it's like pain. Their life falls apart, and then all of a sudden they're thrust on the path, or they go to therapy or something to get healing. But for you, it seemed like maybe there was a longing going on deep down that you were trying to find your way, and yoga somehow clicked for you because you felt relief, and it was like, whoa, started to open that door.
Absolutely.
Cool.
Absolutely.
So I'm just saying that want to underscore that point for the listener, that maybe there's many listeners here who can relate, and yoga might have been one of the first things they stepped into before they started working on their patterns, That's cool. And then embodiment, the whole body somatic work that you're now still doing, you were drawn to the body. Why the body versus the mind? Like, why not just ideas and concepts? And
well, I think it really ties back to my own personal story of realizing how much I felt in my body, that's where it all kind of quote unquote felt stuck. That's where the impasse was for me. And that no matter how much I thought about it or talked about it, it really didn't change. I had been in therapy prior to, I started therapy when I was 17. And I think I started therapy. My parents brought me probably when I was 7. Wow. And I didn't particularly like that experience when I was a kid. I don't consider that one the real start of therapy, but I started therapy again when I was 17, and it was great. And it was with a Jungian therapist, and she helped me a lot, and I was able to do some deep dives, but there was something very different that happened when I went into the deep dive of the body, where I realized that the somatic movement, the somatic experience, opened up something that the talk therapy wasn't going to get me to feel. Yeah,
totally. Okay, cool. So I have so many questions for you, and I want to start with just kind of jump right into it, if that's all right.
Perfect.
You teach a lot about PTSD. So will you define what PTSD and then why your interest is in PTSD as one of your many interests?
Sure. Glad to. So I think I'm going to back up a little bit and just start with what is trauma.
Great.
Right, because PTSD, post-traumatic stress disorder, right? But what is trauma? And trauma gets tossed about in a lot of different ways. It gets tossed about as the event that happened, and it gets it's the descriptor for what happens inside of the individual. And in truth, what we can consider traumatic is any event that could not be successfully processed or integrated immediately afterwards. So it's very normal to feel unsettled, anxious, panicky, shut down, cry a lot, have a bad dream, right? It's normal to have all of those things when we experience something frightening in the world.
Yeah.
That doesn't put us in some kind of pathological state. It puts us into a state of needing support to process something that was overwhelming.
Yeah.
And really, most often, if we have sufficient support in the early phase of experiencing something that was that was overwhelming, that we had the opportunity to work through that. In fact, one of the things that I, say a lot is that actually even our diagnostic coding is taking out what used to be called acute stress disorder, acute trauma, out of the section of diagnostic codes that's pathology. It puts it into normal life events. It says, look, about 90% of us are going to experience some kind of traumatic event across our lifetime. That's what the research shows.
Wow, yeah.
And most of us will be exposed to more than one. So what we're really talking about is, do we have enough support to work through the big emotions and the somatic sensations that arise as a normal response to something that's not normal?
Yeah.
And, and even there, what is sufficient support is very much individual, right? For some people, it's the opportunity to talk about it afterwards. For other people, they need to get on the yoga mat or have massage therapy. For some people, it's a longer course of therapy because a recent event is sitting on top of other earlier life events that maybe also weren't processed, right?
Yeah, totally.
Yeah. So I think there, and then why do I focus so much on that? Because I really do feel like we are, as a kind of a human species, we have so much unprocessed events, right? Traumatic events that kind of get passed on as legacies, right? So even we can look at what didn't get fully integrated by our parents, our grandparents, our great-grandparents, and how that kind of travels through the lineage.
Yeah.
So what I've come to, even just again borrowing from my own personal example for a moment, is to recognize that what got kind of handed to me as a young child from both sides of my families, you can trace back how the kind of the inevitability of what got played out, because there was so much that didn't get dealt with in those previous generations or sufficiently dealt with.
Yeah.
Right?
Yeah. Yeah. And is it possible, I sort of know what you're going to say, but I like to ask these kind of questions. Is it possible to sequence trauma without being in the body?
Without sensing and feeling your body?
Yeah.
I don't think. I don't know exactly what that even looks like.
Okay. Yeah. I mean, it's so important to, it seems to me that this is where talk therapy can be limited, right? Is unless a person's willing to be guided, go into their body and maybe be guided in, because that's where the scary, unprocessed stuff is, right? So it seems like any good trauma practitioner is going to take a person into their body.
Yeah. And we need to recognize how important it is to pace that, because walking toward the somatic experience can evoke a lot of what we call interoceptive flooding, right?
Yeah.
That all of the sensations, that all of the embodiment is where that stuff is held. And sometimes we have a narrative and a story for it. Sometimes it's pre-verbal. Sometimes it's prenatal. Sometimes it's transgenerational. Sometimes we don't know exactly why we feel what we feel. And so it requires a tremendous amount of trust and safety and pacing, which means that we go toward that, what's being held here in little bits at a time. Right? Peter Levine in somatic experiencing calls this titration. Right?
Yeah,
and for those that don't know what titration is, may I for a moment?
Yeah, please. Yes.
Right?
Yeah.
It's a chemistry term. So it's like when you add a little bit of an acid and a base. So if you have a little bit of vinegar and your baking soda and you put them all together at once, you get an explosion. You take a few drops of vinegar and mix it with the baking soda and it fizzles up and it settles down. And that's what we want to do, is we want to turn toward little bits of distress in the body with our awareness. We combine awareness and sensation. We have an experience. We be with that until we integrate it.
Yeah, thanks for that wonderful definition of titration. That's awesome. Quick interruption from yours truly about our conflict weekend. Okay, it's called Accepted and Connected, because that's really what you want, right? Come learn how to get that in 2.5 days here in Boulder, Colorado. We run this event a couple times a year. I think you're going to dig it. Check it out. Here's what Gerald had to say.
I've been working with my wife for the last 4 or 5 years on our relationship, and we made a commitment to each other to work on our relationship and attend workshops. And she ended up finding Jason's podcast and finding information, and we saw this workshop come up. And I was like, yeah, let's go do it. We want to enhance our communication. We're always looking for new tools to be able to step forward to get that next level. So we are more in connection with each other. There's really not much conflict between us. But then as going through this, we found that there's conflict in us. There's more going on that we need to learn how to share and how to be more communicative with it. And this workshop allowed that to flow through for me and to see a little deeper of where I am in my own quest and what's important to me. I kind of work with men's group, and I really want to take this back and take my experience to them. And I think it'd be helpful because it allows us to be vulnerable, because we do talk about getting, our emotions and our feelings and how we are in our relationships. And I think this could be very inspiring for those people that can take a deeper look at themselves and really want to grow.
Amen, Gerald. If you want to join Gerald in his transformation in his marriage, learning conflicts in us and outside of us, come check us out, guys. relationshipschool.com/connected, all right, to get your early bird registration on. Would you also say that, or let me ask it a different way, why is presence so important in this process?
Mm-hmm. And it's to start even with, like, whose presence, right? So that if we're the therapist coming in and sitting with an individual, that I think too often we get separate in this idea that I'm going to do this intervention, I'm going to help the client be present to what's happening for them. Mm-hmm. But it starts with the presence of the person holding the container. Mm-hmm. So therefore, as therapists, we need to do our own work. Yeah. We need to start at home and knowing our internal attachments, knowing our internal history and our own trauma and our own legacies and what we're bringing with us into the room, so that we've been able to kind of clear out the barriers that stand between us and our own presence. Mm-hmm. And then we can offer that quality of slowing it down and pacing and connecting to your breath and connecting to your body, so that sets the kind of foundation and the energetic field, if we might even say, for what we're inviting the client to drop into.
Yeah, awesome. Yeah, I'm glad you mentioned pacing also. I just remember many moments of my Gestalt days where the pacing was too fast, right? Mm-hmm. And then people get sort of blown out and flooded and overwhelmed.
Totally.
Yeah.
Totally. Same thing can happen in somatic work. We really want to slow it down.
Yeah. And again, if for the listener, it's like, why do we need to slow it down? And it seems like to me, so we can be present with what's occurring, right? Mm-hmm. And we can titrate. Because if we go a little fast, we're probably going to lose presence in that process. Mm-hmm. 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 Yeah, okay.
And it's so easy to do. We all will jump out of presence. And then we have the opportunity to come back. Yep. So it's not about, making anyone or ourselves wrong for losing presence. Right? Yeah. It's an intentionality and it's a practice in itself.
Yeah, for sure. Now with PTSD, Arielle, what's the sort of latest research on best practices there? Because there's everything from MDMA-assisted psychotherapy, which is still in its clinical trials, whether that's going to be a legitimate treatment. There's EMDR, there's SE, there's so many options, really. I'm curious what you found the best practices with PTSD are.
Yeah. Well, I will certainly answer with my own bias, and I will also answer from the research. So let me start with the research. The research still comes back to cognitive behavioral therapy and exposure-based therapies. And you have to be careful with research because research has funding dollars. Research happens in laboratory environments. And we can't, we have recognition that there are biases in those environments. The VA still is cautious around other forms other than prolonged exposure and cognitive behavioral exposure models. So the emerging, and here's where you'll come into my bias, is that in my experience, those very models don't necessarily always honor the pacing. They're not bad. Prolonged exposure and desensitization are not bad. They can be very helpful for the right person. But the problem is that sometimes we can get into these protocol-based therapies, which are research-based, and then we're not attuning to the pacing, coming back to that word, of the individual. Yeah. So the therapy, EMDR, eye movement desensitization and reprocessing, which I trained in 2001, I've been teaching it for many, many years, it was developed in order to kind of reduce the possibility of clients going into a flooding state between sessions, of becoming overwhelmed between sessions. Mm-hmm. And so it was developed for the purpose of pacing.
Oh, interesting.
And what it does is it basically anchors what we call dual awareness state, which is making sure that we feel very safe and grounded in the here and now, so that we can turn toward the traumatic memory from the past, but not basically lose ourselves into that state.
Yeah. Yeah.
And so they use this, we use this metaphor of 1 foot in the present and 1 foot touching into the memories that connected to the past. Mm-hmm. And again, from my bias, EMDR, which actually in its full integrity model, it has somatic psychology built right in. It's supposed to be a somatic therapy.
Yeah.
But even EMDR can sometimes get taught as a very cognitive behavioral approach.
Yep.
And so the EMDR and somatic psychology book that Barb Mayberger and I co-authored 2 years ago, the whole intention of that book is to really bridge somatic psychology much more fully back into EMDR, and to give therapists and clients tools of how to be how to work in a very embodied manner through the trauma processing of EMDR.
Mm-hmm. Very cool. So with PTSD, we have our research, but you're saying, which is so astute, of like we have to be present and attuned to see what our client actually needs in the moment. Mm-hmm. Otherwise, if we get too stuck in a technique, right, we're going to miss something probably in the here and now, for example.
Exactly.
Yeah, okay. What do you think about, say, MDMA-assisted psychotherapy?
It's a good question. It's something that I don't really have my finger on the pulse of that. It's not the focus of where I've put my own attention from a research angle. So I know that it's more up and coming, as is ketamine assisted psychotherapy, which I have a bit more of an understanding of, only because I've been working with some folks in the local area that have been involved in the CAP trainings and research, ketamine assisted psychotherapy.
Yeah.
And I would just say that I think all of these, we want to have an open mind. We want to be very curious. Ketamine is a dissociative drug, right? Mm-hmm. So it basically creates a distance. So for someone who is really, really shut down, it actually can help them create some distance to turn toward the traumatic material, and be able to work through something that maybe otherwise would have not been accessible. Mm-hmm. And that said, we have other ways of creating distance, right? So we can use other distancing interventions that don't require
a horse tranquilizer.
Right.
Yeah.
So my 2 cents there. Yeah.
Cool. Coming back to sort of PTSD and its definition versus trauma, for a listener who's like, I don't know, do I have PTSD? Do I just have trauma? Knowing that so many of us, as you said, have trauma, have experienced trauma, big or small, little t, big T. Mm-hmm. When does a person know that they have PTSD, which seems like a bigger deal?
Right. So we can also break this down one more layer here, which is that there's post-traumatic stress and there's post-traumatic stress disorder.
Okay.
Both of which benefit from a caring, therapeutic, attentive relationship. Right? So we'll talk about what are the symptoms of post-traumatic stress disorder, PTSD, which are that I have re-experiencing, that I feel in some way or another I'm getting nightmares, or I'm remembering the event at times when I don't want to be. I'm going to work or I'm parenting my kids and I'm getting flashbacks of events that happened in the past. Or another category of symptoms are the avoidance symptoms. I start avoiding going to certain places or seeing certain people because I don't want to be reminded of what happened in the past. And there's the re-experiencing in the sense of the hyper-arousal, that hyper-vigilance I was speaking about before, feeling like you're not sleeping, the physiological impact of trauma. And then when we look at complex PTSD, which if I can take a moment to define, here we're looking at the impact of repeated, ongoing, chronic trauma exposure. Sometimes this is due to childhood trauma, ongoing neglect or abuse. Sometimes this is related to experiences of being in captivity or domestic violence as an adult that's ongoing and prolonged. But what we see is that there's another set of symptomatic categories that go along with complex PTSD. And again, we can kind of look at all of this as a continuum. But here we might look at having carrying more shame, more distortions about a sense of self. Distorted beliefs about self, about the world, about my future, what I'm capable of, more learned helplessness, that there's more likelihood for dissociation, that there's greater likelihood of having interpersonal problems, really struggling in your relationships, and more emotional dysregulation, which basically means that maybe more likely to fly into a rage or cry uncontrollably. So if you're listening to this and you're going, wow, like I can relate to 3 of those or 5 of those, it's a sign. Even one of those categories of symptoms, it's a sign to just go get support. It doesn't really matter to me what the diagnosis is. It matters to me that if you're experiencing symptoms that are distressing to you and you can't find a way through it on your own, then it's a wonderful opportunity to seek support. We're not meant to heal by ourselves. Right?
Yeah. I'm glad you mentioned the shame piece too, that Bessel van der Kolk talks a lot about in terms of often it's not the trauma itself, it's the self-judgment about what I should or shouldn't have done, right? Yeah, that's another layer that we need to work with when working with trauma, right?
Right. Sometimes we can also refer to that as moral injury, that there's some way in which who I have been in the world is not in alignment with my values or who I want to be in the world. And I have to kind of come to terms with that. Whether it's because of something that happened to me or how my body responded to something that happened to me, right? Or because of something that I did. Or didn't do, right? And I've worked with siblings, for example, who couldn't protect, a client who couldn't protect their sibling from abuse. That sense of responsibility, and yet you were just a child.
Right. Yeah, you didn't have the power to. As we wind down, there's so many questions. We're going to have to do another round because I wanted to get into the vagus nerve and sympathetic and parasympathetic, but that'll maybe be for another one.
All right.
In terms of you talk a lot about resiliency, and will you say something just for a listener, because you talk about like resiliency being the thing that we need to just tap into to kind of face our trauma and to work through it and to overcome whatever we need to overcome. What's something a listener can do to kind of flex those resiliency muscles so that they can go get help or they can work through the difficult experience?
Great. I know lots to say on that topic. It's a favorite one of mine. First of all, just as a definition of resilience, we're looking at the recognition that we can flexibly adapt to what our life circumstances have been, that we don't feel stuck or at that impasse. And that resilience is really both, and this will tie a little bit into your vagus nerve question, although we'll come back to it in another interview, but that resilience is both a psychological process in terms of that I can be a flexible thinker, that I'm not stuck inside of negative beliefs about myself or about others, that I can actually have more spaciousness of mind. And resiliency is a physiological experience in which I talk a lot about nervous system flexibility, because when we've experienced trauma, we tend to get stuck in one of two states. One is the state of kind of hyper arousal, mobilization. My defenses are up. I'm quick to anger. I'm quick to be anxious. I'm quick to want to flee out of the room, right? Or we get stuck in an immobilization response in which we feel more depressed, more collapsed, more shut down.
Yeah.
And that this is where yoga for me has been such a key, is that we can work with that physiology through the vagus nerve, through the connection to breath, through the connection to movement, and reclaim nervous system and physiological flexibility, that I can go between more active states and more resting states and not feel that I get stuck at one extreme or the other.
Yeah,
and
nice.
Yeah, and sometimes with complex PTSD, I'll describe it as, like driving with your foot on the brakes and the gas at the same time. It's like people are just kind of bouncing back and forth between panic and collapse.
Yeah.
And it's hard to find that, that sweet spot of nervous system regulation or calmness or connection.
Yeah, totally. So when we take that definition of resilience and we apply it to our life, and yoga, it sounds like, is one thing that we can do. What's something else we can do to cultivate this within us?
All right. So, resilience is both a process and it's an outcome. So from a process perspective, we build our resilience by turning toward our emotions, by leaning in, and what you do so much in your work with couples is like leaning into the vulnerability of connection, allowing ourselves to feel the uncomfortable edges. And through that, we're actually growing our resilience. So when we allow ourselves to be vulnerable, that's a wonderful resilience practice.
Yeah, great.
From a, I talk a lot, and this is in the Post-Traumatic Growth Guidebook, I talk about building your own resilience recipe, of recognizing like these are the practices that I want to have in my day or in my week that help me feel more resilient. It could be time in nature. It could be time on your yoga mat. It could be time writing in a journal. It could be time spent in intimate conversation. It could be going to therapy, right? There are so many different ways to build that connection to ourselves and to soften. Some of the research around resilience that I just love so much is that one of the key factors is a belief system and recognizing that we can grow even through difficult life moments.
Yeah.
And another is the ability to stay involved in your life, to know that your behaviors, your choices can make a difference in the outcome of your life. And that the individuals who dropped into more of a helplessness state, who didn't have that self-efficacy, that knowing that my behaviors are going to lead to a new outcome, had much greater likelihood of developing post-traumatic stress disorder, right?
Yeah.
But that the individuals who said, I'm going to stay involved in life, I'm going to go seek therapy, I'm going to go talk to people, I recognize that even though it's hard, making these choices will make a difference. That is really a huge way of building your resilience.
Yeah, that's cool. And I appreciate the did you call it the resiliency recipe? Yeah, that's sweet. Yeah. So that's found in your book. Will you tell us a little bit about your new book that's out?
Well, I will. I'll hold it up for a moment. So this is the Post-Traumatic Growth Guidebook, and it's on Amazon. You can find it there. It has a bit of my own story in it. It's based on an arc of a hero's journey. And so it invites you to go through basically 60 guided practices of how to build your resilience, how to work through difficult traumatic events, and how to ultimately feel like you can grow and awaken to your potential. So that's really the point of it. It actually loops us in a small way back to Naropa. And one of the things that, in addition to the somatic psychology, that was really a huge takeaway for me there was that Naropa kind of flips psychology on its head. It's not a pathology model there, right? Yeah. It's a model of turning toward the core of what we call basic sanity or goodness inside of each individual, and this recognition that that is available for all of us. And so I just had this conversation with a friend yesterday who There's someone in our community that's struggling right now and has been hospitalized, but is getting worse in this process. And there is this way in our traditional medical model that when we put the magnifying glass on the pathology, on the what's wrong, it starts to become all that we can see.
Right.
So a strength-based model of psychology and a resilience-informed model is basically taking that magnifying glass and putting it on the basic goodness, putting it on the health, that core of intrinsic vibrancy and capacity that lives inside of us, and letting that grow. And the recognition that from there we can start to clear out the obstacles that stand between us and that truth.
Yeah. Amazing reminder. Thank you for that.
Yeah.
Yeah. So where can we find you? ArielleSchwartz.com. Is that right?
It's drarielleschwartz.com. It's just arielleschwartz.com. And Post-Traumatic Growth Guidebook is on Amazon. There's also the Complex PTSD Workbook, which came out in 2016, and EMDR and Somatic Psychology book. And lots and lots of free information on my website, just years of articles that I have out there about the vagus nerve and about resilience and healing from PTSD.
Yeah, very cool. One last question, Arielle. I ask every guest this. Here at the Relationship School, we want to reach 1 million teens and young adults with just the kind of education that's like, here's how we work out our differences. Here's how you listen to someone. Like, here's how we love someone. And if I were to speak in front of 1,000 teens, high schoolers, let's say, maybe your kid's age, and I could only share one message with them about relationships, and you were whispering in my ear, what would you want me to say to them?
Oh, I love this question. So to me, when we're working with our own difficulties, it's not just personal work, it is world work, because it's about coming into the maturity and recognizing that we all have inner conflicts, even within ourselves, let alone with others, right? So that there may be times where we think one thing, but we're doing something else, or we feel love and hate for the same person. And that the recognition that we can hold more of that, those polarities is very yogic, right? But those dialectics, those contradictions within us, when we can hold that and be soft, be compassionate with ourselves, we are much more likely to hold that other people are going to be different from us. We're much more likely to embrace that we're not always going to think the same as other people. That right there is world work. I mean, I wish that not only could our teens know that, but our world leaders will know that. And of course, our teens are the up and coming future world leaders.
That's right.
So
cool. Thanks for that.
There.
Thanks for that message to them.
Yeah,
cool. Dr. Arielle Schwartz, thanks so much. Great to see you again. Say hi to your family.
It's great to see you.
Yeah, thanks again.
Likewise.
Wow, great interview with Dr. Arielle Schwartz, and we touched on some really good stuff there. I wanted to go deeper into it, but time doesn't always allow. But hopefully it was a good overview of trauma, PTSD, and resiliency, and what you can do in your own life on the resiliency side of things, and really some modalities, that you can work with. Okay, so if you feel like you've experienced significant trauma, then here's your action step, okay? So go to drarielleschwartz.com and get her book is certainly one resource. And we've interviewed a lot of people, including Bessel van der Kolk on this podcast. I would go back and listen to that podcast. And get help, okay? That's like your action step is get help. Go see a practitioner that specializes in trauma work. Do not go to a talk therapist and tell your story. The best therapists, I think, out there are specialized, and they specialize in something like trauma. They're trained by people who study this stuff for a living and how to sequence trauma. So, that could be an SE practitioner. That could be a sensory motor practitioner with Pat Ogden, who I've also interviewed on the podcast. That could be Arielle. That could be EMDR in your local town or city. But there's a lot of ways actually now. We have really good science and we have really good methods to work through trauma. There's no need to stay stuck in trauma loops, guys. you can get really good help and work through it, right? And the first step is to ask for help and say, yeah, I can't figure this out on my own. I need help, right? And then share that with a friend. That's we always make this a relational action step now. So tell someone in your life, look, I have some trauma that's unprocessed, unfinished, and I'm going to get help. Or will you help me get help? Or will you hold me accountable because I tend to not ask for help, etc. All right? Excellent. Okay. Thanks everybody for listening. Join our free Facebook group, relationshipschool.com/community, if you want to get in on that action. And eventually consider our trainings, all right? We have a weekend workshop coming up on conflict in the East Coast at Kripalu, and then another one in Boulder at the end of spring, beginning of summer, around end of May. So keep that on your radar. All right, folks, enjoy, and we'll talk soon. Thanks so much for listening, Relationship School fans and Smart Couple listeners. Please subscribe to this YouTube channel, all right? Do us a favor, subscribe, share one of these videos with a friend, all right? We want to help the planet get their act together around relationships, and you are one of them, so thank you.